And kind of, I know most people, especially if they're coming out of coding program, if they're getting their coding certificate, receive their coding certifications, all of the things, you're taught one thing in textbook. And then oftentimes, we have programs that will provide you some real world encounters and real world experiences. Pay attention to that because it's going to be different once you get, because you don't have your instructor, professor, or whomever coming behind you to check you to say, okay, yeah, you did a great job. No, you're on your own at that point. So you need to make sure that you have the necessary skills and necessary tools correctly. Yeah, absolutely. Wait a minute, Dr. Jasmine, let me put your. So that's why it's important to use more experiential learning and cases into coding, education, and training. Absolutely. Coding is not prescriptive. It's not always packaged neatly. Absolutely. And that helps you stand out as one of the best coders, right? Because you've taken the time to understand it's more than just saying, okay, oh, here's a diagnosis. Let me go through, whatever tool you use. I will say my book, but let me go through and pull out a code. It's way more than that. Coding is way more than that. That's why we're a STEM program. That's why, we do all of the things that we do because it's more than just that, right? Okay. um, so let's say you have a patient who presents for diabetes follow-up. Let's see, their A1C has increased from 7.2 to 8.5. They have a new complaint of numbness in their feet and they are on multiple medications. Let's think critically about this. Is this a stable chronic illness? What you think? And y'all can talk amongst yourselves in the chat. What's the significance of the numbness? You see, is there something that you need that should, ring bells for you when you see additional things related to the follow-up care for a particular patient? And then how do the medication interactions affect the risk? So see, this is where your clinical thinking elevates your coding, right? And this is where you have the missed opportunities. This is where I said, you could be the star in helping make sure that, or increasing revenue because you're not undercoding these complex patients. Somebody who doesn't critically think or use their clinical skills to say, wait a minute, this isn't just, just a cut and dry case of XYZ. No, it's not that. This is something a little more serious. This story, not just counted. That's a quotable. All right. So hopefully that kind of gives you some additional food for thought as you are either embarking on this coding career and profession, living through this coding career or profession, or even a seasoned coder who may not have gotten this information and you're like, oh, I didn't know, I didn't realize, I didn't recognize. I don't know why not, but it happens, things happen, and remember, a good coder knows the rules, but a great coder knows why they exist. Right? We talk about that all the time. There's a whole machine that operates on why it is that you're supposed to do what you're doing, why these rules are here based on all of the stuff that's going on. As a coder, you should think clinically first, then code. Understand the why behind the elements that you're looking at, and then trust your critical thinking skills. All right. So I hope this episode helped you. Don't forget to like, subscribe, and hit that notification bell and share this information with your coding friends. We're all in this together. And while, y'all, I'm putting y'all up on game and now y'all have something that y'all can share with somebody else, right? So share with your friends. Sharing is caring.